Hey guys, how are you doing? Thanks for joining me today. My name is Edith, and I am going to be talking about status asthmaticus, which is severe asthma exacerbation. That's a big word, but yes, I'm going to break it down. It means asthma symptoms that come in severity, and it doesn't matter how much medication you take or what you do, it just keeps coming and coming and coming. So that is severe asthma attack or exacerbation, which is also called status asthmaticus. So it keeps happening. It just keeps coming. So asthma, as I said last week, is a potentially serious chronic airway disease. It causes a lot of burdens to the patient. I don't know if you've ever seen someone with asthma. They have a difficult time breathing. They feel like they're going to die. They cannot go to work. If it's a child, the mother cannot go to work. It just kind of destabilizes the entire family. It's something you do not want to experience, I promise you. And sometimes they require a lot of health attention. They require a lot of health care because what happens is it could be fatal. The symptoms could lead to a very fatal incident. And then, like I said last week, asthma is it comes with symptoms, respiratory symptoms such as wheezing. You hear them, they kind of have a hard time breathing either in or out. They make this very, very, very tight sound when they're trying to breathe, and they have shortness of breath. They cannot breathe. They feel like they're going to pass out. They're going to die. They also have chest tightness, and then they cough, and it could be during the mornings or at night. Usually most of them come at nighttime. And then this can vary in occurrence. So depending on the individual, the symptoms could be, very mild to moderate to severe to, very severe symptom. Now, these symptoms are associated with reduced breathing on expiratory outflow, and this is because the lungs have a hard time sending. There's a difficult time for air to go in and out of the lung because of the constriction. So, like I said last week, when there's a trigger, it could be some allergens and whatever causes an inflammation. So it causes a swelling. It could be that the individual was exposed to pollen. It could be dust. It could be just anything. It could be because they exercise. It could be some cold air. It could be just very minute things. And then their immune system kind of responds in a way by tightening the bronchioles, which are the passageways to the lungs. And because these bronchioles swell and then contract or constrict, it's hard for the individual to take in enough oxygen. And guess what? That could cause a severe lung damage if not attended to. Now, some variations in airflow can occur in people without asthma. So it is not everyone who has a hard time breathing that actually has asthma. Now, asthma affects about 300 million individuals worldwide. This is a huge, huge number, and that is why I'm bringing this to you today. Hopefully that this information will go a long way to saving someone. Anybody your children. It could be just anybody. So this affects all age groups. It affects young ones. It affects old people. And then think about it: older people who have a decreased their capacity breathing. Everything kind of decreases. They could even be more prone, especially older women. Young children, young boys are seen to have asthma, and then older women are seen to have adult onset asthma. Now, this costs a lot in treatment. It costs a lot. It's not cheap. It's not convenient. I don't know if you've ever seen someone who has asthma. After a publication I made last week, I had a whole lot of emails, and I feel so bad. I feel so bad for these people because I could see their pain. I could feel it. It was, it was just terrible. So if you've ever had asthma, or if you have someone who has asthma, you can relate to what I'm saying today. And I hope that this information will at least help us prevent those acute attacks. Now, asthma still contributes to many deaths worldwide. Like I said, over 300 people people, 300 million people, including young people, and it imposes an unacceptable burden on healthcare system and on the society. And think about it, we have societies where they have very poor access to healthcare. We have societies where they do not have doctors. We have societies where they do not have adequate emergency healthcare system. Now think about what happens when someone cannot breathe in the middle of the night at 1 o'clock in the middle of the night. They wake up, they can't breathe. There is no car to take them to the emergency room. There is no doctor in the emergency room. There is no road leading to the emergency room, or there is even no emergency room. So these are things that I want us to take really, really seriously. And hopefully, I pray and hope that this would make some impact. Now, especially in the young kids, we have a lot of young kids who, for so many reasons, it could be because they were born prematurely, the lungs did not develop very well. It could be for so many reasons, gestational reasons. It could be, it could be anything. It could be genetic, because asthma is also genetic. It could be caused by occupational exposure to allergens. It could be caused by, sexual factors like boys versus girls, like I said earlier, and then older women. Now, factors that may trigger or worsen asthma symptoms include viral infections. So when an individual has a viral infection, an individual who has been having asthma or who has respiratory illnesses or comorbidities, meaning they have other things going on, a viral infection could cause an asthma exacerbation. It could also be allergens from home, people who have carpets, they don't clean them. It could be mold, it could be dust mites, it could be pets, it could be denders, it could be something from your dog, from the cat in the house, and all of that. It could also be tobacco. So if you have someone smoking in the house, if you have secondhand exposure to smoke, or if you smoke yourself, you could be at risk for a severe asthma attack. It could also be exercise and stress. So people who have asthma, when they're stressed out a lot, and of course, like I said, it's the immune system responding to, a trigger. It responds, the immune system tries to protect, it tries to react to something strange in the body. So stress can actually trigger the immune system. Now, these responses are more likely when asthma is uncontrolled. So asthma can be induced or symptoms triggered by some drugs that are actually drugs that can also trigger acute asthma exacerbation, such as some blood pressure medications called beta blockers and aspirin or other kinds of NSAIDs, which are non-steroidal anti-inflammatory drugs, such as ibuprofen, Advil. I don't know. It depends on the country. Different countries have their brand names and all of that stuff. Asthma flare-ups can be really, really fatal. I am telling you, it could be really bad. A lot of people that have had horrible flare-ups have ended up being intubated, being on ventilators. A lot of people have died from asthma attacks. I saw a little kid that ended up with cardiovascular. She had a heart failure because there was not enough oxygen, to pump blood throughout. And it was just a whole sequence or sequel of symptoms that she suffered because her lungs shut down from asthma. Now, they are very common and more severe when asthma is uncontrolled and in some high-risk patients. Now, however, flare-ups may occur in people taking asthma treatment. So it is very important that if you have asthma, you develop a treatment plan or an action plan with your doctor. Fortunately, asthma can be effectively managed, and most people have achieved good control outcome. And when the individuals, if you want to know if your asthma is under control, first thing, there are usually no symptoms at night or in the day. There is little to no need for relief medications, which are like the PRN, especially the steroids that help reduce inflammation in the lungs. And they become more productive. They go to work. They don't miss school. They don't miss work. They have a normal or near normal lung function. So the lung functions kind of become better than it used to be. Then they do not have flare-ups, so they don't have more frequent or very frequent asthma asthma attacks. So asthma treatment should be customized. It depends on the individual, and we have to also take account. So this comes to what I'm going to be saying in a few weeks from now. Self-medication. So that your grandparents or your father had asthma and used this particular medication does not imply that that same medication is going to work for you. So the treatment has to be individualized. It depends on the symptom. It depends on the severity. It depends on the individual's reaction, to the medication. You could be allergic to your mom's asthma medication. So it is very important that while you're attempting to manage your asthma, you make sure you consult your doctor, and you have to develop an individualized plan or medication regimen. And also, you want to consider your safety and the cost of the medication. So if your doctor gives you a prescription and it's really expensive, don't be afraid to go back and say, hey, doctor, I couldn't afford this medication. There could be some other generic medications that might work for you in about the same way. Now, an action plan for asthma tells you or whoever has asthma how to recognize when the symptoms are worsening, how to increase your medication, and how to seek help and when to seek help. So the plan you can develop with your primary care doctor, and of course I'm just trying to enlighten us on some of these preventable illnesses, but of course you have to see your doctor. This is in no way meant to treat or diagnose. This is just an education. This is just the educative part of the patient care. So now, if you develop the action plan with your doctor, that tells you what to do, how to take your medication, and at what point, if the medication doesn't seem to be effective, you need to see the doctor. Now, they probably put you on some medications, but please, I want you all to understand that there are certain medications that the doctors have to put the patient on, and you do not stop them abruptly, like your steroids. If the doctor gives you some steroid, you do not stop your steroid abruptly, especially if you're taking it over 7 days. Now, the long-term goal for asthma management is not necessarily to cure asthma. It is to reduce a reduction of symptom control. The goal of the treatment plan you're going to be having with your doctor is not to say, hey, you're asthma free. No, it is actually to reduce the frequency of symptoms and to actually control the symptoms and prevent fatalities that could occur from a less managed asthma, if that makes sense. The aim is to reduce the burden also on the patient and to reduce the risk of asthma related deaths. Now, having uncontrolled asthma is an important factor for exacerbation. So if you've been having uncontrolled asthma, your asthma is not, well taken care of, there are high chances that you're going to be having exacerbation. And exacerbation means worsening. It means an asthma that comes in and it feels like it's going to kill you. Now, additionally, additional potential modifiable risk factors for exacerbations in patients with few asthma symptoms are medications. So if you have medications, you have to always make sure that you go back and forth and modify the medication with your doctor. If you have obesity, if you're big, if you have other health issues, if you have hypertension, if you have respiratory illnesses, if you have allergies or things that could actually trigger this asthma attack, you might also have to go over that with your doctor. If you're being exposed to smoke, if you're being exposed to allergens, if you don't have money for treatment, also you need to speak with your doctor. If you have very decreased lung function, it is very important that you consult your doctor at every point in time. And of course, if you've ever had to be intubated, if you've ever had to be into the ICU where they put a tube down your throat to help you supply oxygen to your lungs, then yes, you need to see your doctor. Now, how do people who have status asthmaticus or severe asthma exacerbation look like? Now, they come around, they have very high heart rate. So their heart rate is going high, meaning because they're trying to compensate. The heart is trying to work really hard to supply enough oxygen and blood to the systems. Now, in the early stages, they might have some significant wheezing. Now, if at any point the wheezing begins to reduce, it does not mean that the individual has gotten better. It means that the symptoms are really, really getting worse. Now, initially, the wheezing is heard during breathing out. So when they're breathing out, you hear them making this, those kind of very difficult breathing sounds. But now, later on, it comes during breathing in and breathing out. Okay, so when you see the patient, or if you don't know when you're having severe asthma attacks, you could figure out that your lungs are beginning to your chest is expanding, meaning that you're beginning to use your accessory muscles, which include some of the muscles in your chest region, to breathe. You're working so hard to breathe. Now, at this point, like I said earlier, the wheezing might disappear, but it does not mean that the person or you are getting better. Now, there's a huge difference between, not really huge, but sometimes you could see a difference between the top number of your blood pressure, which is a systolic, and the bottom number, which is a diastolic. So when this difference in your systolic, which is the top number, becomes really significant, sometimes with a difference of about 25 millimeter mercury, it could really indicate severe airway obstruction. Now, in such cases, sometimes we've seen individuals who have difficulty speaking because they cannot breathe, and so they can't make any sound that makes sense. Yes, they might be having a severe attack. Now, as it progresses, the level of consciousness, meaning the level of consciousness begins to reduce, meaning that the person begins to be probably unaware or disoriented because there is not enough oxygen going to the brain. So this begins to happen. The progress is just steady. And at this point, you do not want to sit down and keep looking at the individual or maybe keep praying. You need to go see. Before now, you need to have been at least in the emergency room or under the care of a physician or someone who is specialized in asthma management. Now, there could also be a difference, which is it's called a pulsus paradoxus. It's a decrease in the systolic blood pressure during inspiration, and this can come because there's a reduce in the whole mechanism of the cardiovascular or the heart system. Now, when there's that huge difference of about 25 millimeter mercury, then you need to be with the doctor. Now, there are no specific guidelines. There's nothing that says, hey, if you have asthma attack, take medication A, B, and C, and you'll be fine. Now, there's nothing of such nature. I know that several asthma societies worldwide are seriously working to ensure that they provide the best research or evidence-based therapy for asthma exacerbation management. But right now, there's been nothing. So really, if you have any of these symptoms that are related to asthma exacerbation, you need to see the doctor. First of all, they want to reduce the inflammation and, of course, prevent other complications from decreased or reduced airway oxygen supply to the lungs. Now, the most important guideline I want you to know for preventing asthma is just staying away from anything that triggers it. Now, stick to your medication. Do not take someone else's medication. Whatever you do, try as much as possible to be very, very much aware of yourself. Be aware of the medications that you take. Be aware of the expiration date. Make sure you check the expiration date of your medication every now and then, because if you're having an attack and you're using an expired medication, it will not work. It would definitely not work. Now, another thing that I want us to know is the importance of seeing your doctor on a regular basis. You do not have to wait until your asthma becomes very bad before you actually go see your doctor. It is very important that you develop an action plan. It is very important that you go for medication reconciliation. Make sure you at least go over your meds every now and then, and buy medication from trusted sources. Do not stop over by street pharmacies or street whatever and pick up your medication, or try to self-prescribe medication for your management. So I hope that I've been able to at least throw some light on this topic, and I'm so thankful to all of you who have tuned in, and I look forward to seeing you again. Until then, have a wonderful, beautiful week and stay healthy. Bye-bye.